All right, hello everybody. Today I'm going to be talking about reality orientation, validation, and reminisce. We're going to jump right into it, and we're going to start with reality orientation. Reality orientation was developed by J.C. Folsom and his team. It started in 1959 in Kansas at Winter Veterans Administration Hospital. The director at the time was seeing a lot of staff burnout and patient inactivity, and he wanted to combat this, so he tasked J.C. Folsom with that task. Folsom collected a team, and their main goal was to lessen anxiety in their patients, and he did this two ways. He did it first by stating that encouraging his staff members to tell their clients that it wasn't important to remember staff or other patients' names, only to be willing to give their own name on request. And the second was to engage their clients in purposeful tasks. This created generativity, and it also gave those clients a sense of purpose, belonging, and that really what lessened their anxiety. Early guidelines included calm environment, set routines, clear response to patients' questions, and clear questions should be asked of the clients, reminders of the date, time, etc., and being firm when needed, and also not allowing clients to ramble in their confusion. And also something very important was being sincere. Intended client groups include post-operative confusion, and dementia, neurological conditions, and traumatic brain injuries and PTSD. As a side note, I did clarify in this is that it's early stages of Alzheimer's or dementia, because otherwise this can be really detrimental to the client if they suffer from moderate to severe Alzheimer's. It only leads to more confusion and frustration that will eventually lead to behaviors. So it's important just to only use validation or reality orientation therapy with early stage Alzheimer's. Another thing that's important to note is that with traumatic brain injuries and PTSD, this form of therapy did start in a veterans hospital. So that's why it's very important to remember that it could that he was working with PTSD and different things like that. The basic premise is a formal or informal program to assist the patient in knowing who they are, where they are, and when it is. This program includes both verbal and nonverbal cues. Really, the intent is to improve quality of life. And they did this by using two formats. And the first form was the classroom kind of setting. Is that you split clients into groups based on their level of function, and that this is a regular class that meets on a regular basis, that provides basic reality information. The second is 24-hour, which means the staff will incorporate reality orientation into every interaction, whether that's saying hello, or other needs. They will incorporate this. And there's a second part to the 24-hour is it's called popular incidental interactions, which usually includes a reality orientation board, which is usually in a community place, whether that's a hallway or whether that's a dining room or a common room. Here are some examples of reality orientation boards. You can see that you have the day of the week, the weather, the month, the year, the date, and even upcoming holidays. You can also see that, some choose to include a clock so they know what time it is. According to Folsom, there was a 50% documented positive improvements of patients almost to the level of pre-hospitalization. Obviously, this wouldn't be with dementia patients, but those with traumatic brain injuries, post-operative surgeries, etc. In 1989, reality orientation was shown to improve cognitive function and behavior in dementia. Again, this is only for early stages of Alzheimer's and dementia. Since the 80s, there hasn't been a lot of recent research on reality orientation, but it is considered the precursor to cognitive stimulation. So here is kind of like the staff, an example of what a staff member would say to a client, and I kind of highlighted the places that were more important to draw your focus. And good afternoon, so you're saying the date. Are you in, Mr. Roberts, are you enjoying the lovely sun? It refers to the weather outside. We're having this chilly December. You are connecting cold with December. If you'd like, you can join us for a snack in the dining room. So you have snack, dining room, and then finish here at Seneca Place. So you have two places that bring specific memories or images to mind. And we're going to move on now to validation therapy. And just background on validation therapy. Naomi Fell is the creator of this, and she created it in 1963, and it's been an ongoing developing process up until the 1980s. The reason why she created this is that there was a dissatisfaction with traditional methods dealing with dementia. There are currently 9 countries that are authorized to practice validation, to practice and to have an organization. The main purpose is to stimulate interaction, encourage participants to take on social roles, generate a sense of well-being and happiness, develop social control, and increase verbal behaviors. Intended client group is, again, dementia. And dementia doesn't just affect one person, it affects family members and friends and etc. So being an advocate for this is very important, especially as healthcare providers, and you can pass this information and you can train this information with healthcare providers, family members, and friends. The basic premise is basically Naomi believed that disturbing behaviors like calling out or aggressiveness or different things like that are purposeful behaviors. They're not just part of the disease process. They're behaviors working to resolve the issues that affect them. And it's important that we take an empathetic approach to when we're dealing with clients like this. There's 14 techniques that she suggests, and these I took from our book. So if you really want to read about them and find more information about them, go to our book. Blank slide. Application to therapeutic recreation. It's important to advocate, like I said before. And the second, when we are doing validation therapy, it's important that we create groups and assign roles, because this helps our clients meet their goals, but it also meets the goals of validation therapy. And so another important aspect that needs to be added to validation therapy is to include movement, music, and have a discussion topic. Usually they'll assign someone to be the greeter or the chorister or something along the lines of that. So movement, music, and roles and discussion topics are important when you're meeting with validation therapy. Okay, we're going to move on to Reminisce, and Reminisce is kind of close to my heart because we did a lot of Reminisce when I worked on a dementia unit, on a memory care unit. What I didn't know at the time was how much it can affect, but the background and history of Reminisce is spontaneously occurring human behavior of recalling the past, and that's a definition that some researchers have come up with. And Reminisce therapy can be used in a group and individual modalities. It can have a positive effect on a wide-reaching even on cognitive, psychological, social behavior, health status, and Reminisce may contribute to emotional regulation in various populations. Moving on, the intended client group. When you think of Reminisce, you think of Grandpa Joe on the front porch telling you stories. So it's definitely connected to the aging, but something that surprised me is that it's connected to children and relationships. And while it makes a lot of sense, I just never put two and two together. It includes nursing home residents, psychiatric conditions in geriatric populations, and even with the denial of death. The basic premise is to basically use these to remember the past. And there are 8 functions of Reminisce, and they're identify, problem solve, death preparation, teach/inform, conversation, bitterness, revival, boredom reduction, and intimacy maintenance. It's important to remember that you can cause a variety of emotions when you are reminiscing. And for some, remembering pets might be a positive example because they loved their dog Max when they were 10 years old. But for another, it might remind them of a dog that ran away or something. So it's important to remember that Reminisce can cause a variety of emotions, both positive and negative. The process of Reminisce is starting out by staging, so definitely be a listener. Starting out, you want to find an area that is quiet and provide the physical and social environment that helps engage an individual. Usually, you definitely want quiet because otherwise it could close someone off or just not allow them to focus. Maintaining interest and focus throughout the Reminisce process, and then ending the session on a positive note, making sure that you're ending before anyone is too fatigued or there's discomfort or restlessness. Program content. You want to ask appropriate and interesting topics. You're not going to ask a child about working on a car. Or you're not going to ask a kind of someone who grew up in the 60s about a 60s husband who grew up in the 60s, repetitive. You're not going to talk to them about doing laundry. You're going to definitely talk to him about that car. You definitely want to use stimulants. And I always like to use all the senses when you're discussing this. You're going to want to, when you're setting the stage for your Reminisce, it's important to have the proper stimulants to jog that memory or to jog that understanding. So I worked on a memory care unit, like I said before, for a couple of years, and I put together these Reminisce kits. And so this is Mom's Kitchen. You have a variety of tools to bring back. You have a cookbook in the middle. You have a picture of Mom's Kitchen, and you have kind of a sensory worksheet to the right. The next is Beach Vacation. You have bubbles, you have animals, you have flip-flops, you have a bathing suit, you have sunscreen. So you can definitely turn this even into a sensory experience as well, even if you add beach music to this. Preserving and canning is a great activity because many of the clients that I worked with were women who were housewives, and they did a lot of canning. So, and again, it was a mostly female population, but a lot of it focused with children, and you can see here the baby clothes and the smell of the baby powder and the smell of the Johnson baby lotion that brings back those memories. You have a diaper, you have a pacifier, you have pictures of babies. And this was definitely one of the more positive ones that got definitely all the ladies talking because, you know, each of these had children and grandchildren, and it was just something that they loved to talk about. So here are my references. I hope everybody has a wonderful weekend, and I'll see you soon. Thanks. Bye-bye.